For our next session here, we're taking a bit deeper. We're going broad and then also going deep. That's kind of a theme, I think, in this meeting overall. Wanting to give you a background on what we know can cause cancer from environmental and occupational exposures. And I emphasize, this is a symposium on cancer and the environment. Many of our communications with you have included occupational, and you'll see why in our next talk. Much of what we know about environmental causes of cancer comes from the occupational literature. We share exposures. These are the frontline workers. They're most heavily exposed. And so we like to keep the things together. We are elevating the topic of environment here, but very much in how we think about strategies, workers are very much included here. But our first speaker will kind of go into a little bit more on this. And so we're going to run the session in a similar way. We're just going to have each of our presenters speak. We have 3 in this session, and we do have ample time for participant engagement at the end before breaking for lunch. And so with that, I'd like to have Dr. Ellison come and join me here. So we're pleased to have Dr. Gary Ellison, and he comes to us via the National Cancer Institute. Gary is chief of the Environmental Epidemiology branch within the Epidemiology Genomics Research Program at NCI. And within this program, Gary oversees its research portfolio. So we're going to hear, this is the home of this work within the National Cancer Institute. It's a very small program, but a very robust and important one. And so Gary's going to be able to kind of share a bit more about where NCI has its focus. This is going to be important, I think, for a lot of our researchers in the room to know kind of where NCI is also prioritizing its research in this way, in this realm. So with that, I'm going to give it over to Gary.
Thank you, Molly. I appreciate the introduction. And I was wondering, how in the world am I going to go after this last panel? It's going to be a tough job, but I'll do my best. As Molly mentioned, I oversee a program of research concerned with the environment and cancer. And within my group, we define the environment broadly to include the chemical and physical exposures that we've heard a lot about, but we also include tobacco, alcohol, obesity, energy balance, infectious agents, and we're beginning to think more broadly about the environment, some of the things that Ted mentioned earlier, to consider multi-level factors, so neighborhood environment and how that may affect cancer risk. So what I'd like to do today is just to give you a historical perspective on the environment and cancer, and go into a little bit about occupational carcinogens and how they've been listed and the cancer sites they have an effect on, and also talk about some of the things that we're supporting. I am from the funding arm of NCI, what we call the extramural division, and so we support research that's done by individuals at universities and cancer centers. And then talk a little bit about our priority research areas and summarize with a few recommendations for research. Now, in this, I didn't know that this would be animated. So in the 17th century, children were involuntarily employed as chimney sweeps. And you can see here in the picture where they have the thing that they use to go up the chimney. And they were chosen because they were small and they could fit in the chimney. But you can see all of the soot on their face. So they were exposed with a lot of these things, what we know now to be carcinogens. And this was also portrayed in Mary Poppins, where I believe his name is Jack, played by, what is it? Dick Van, yeah. So he was a chimney sweep in that. And so it was portrayed in the movies. And little did they know that then that this was a cause of scrotal cancer. And it wasn't until an 18th century British surgeon noticed that a number of these individuals were developing cancer of the scrotum. And it wouldn't be until many years later until policies were put in place that would prevent children from working in this field. And also a century after that, where the actual cause of scrotal cancer among people who were exposed to soot was found. And we know now that it was a combination of the soot and the chemicals called polycyclic aromatic hydrocarbons that caused it. So later on, Dahl and Pito in the seminal work in 1981 estimated the percent of cancers, the percent of exposures that would cause cancer. And they estimated that 30% of cancer deaths were due to tobacco, 35% of deaths due to diet, and 2 to 8% of cancer deaths due to occupation. Now, we've already heard the problems of trying to estimate the proportion of factors factors that cause cancer, and we know about the problems about the population attributable risk. However, this study had a profound influence on cancer control priorities, and what we see today, where the bulk of the effort is focused on reducing cancer associated with these exposures, tobacco and diet, but little focused on the environment. So there have been attempts to identify occupational carcinogens, and as Molly mentioned, much of what we know about cancer in the environment comes from studies in the occupational setting. And 2 of these studies done by Samiateki in 2004 and Loomis updated in 2018 attempted to list occupational carcinogens. IARC does not list occupational carcinogens. They list a number of carcinogens that individuals are exposed to. However, they don't designate them as occupational carcinogens. And so this work was designed to list those that they thought would be important in the occupational setting. They had different approaches to doing that. Samiateki defined an occupational carcinogen if more than 10,000 workers were exposed worldwide, and that levels were at or above population levels of exposure. We know that in the occupational setting that folks in the workplace are exposed with higher levels of the exposures, most of the time, not always, than the general population. And then in 2018, Loomis, they had a slightly different approach, and these are the criteria that they use to define an occupational carcinogen. So in Samiateki's work, he found that 28 of the agents and mixtures were definite human carcinogens found in the occupational setting. This was represented about, I believe, 30% of the overall carcinogens, about 31%. There were a total of 89 occupational carcinogens 89 carcinogens, group 1 carcinogens identified between 1972 and 2003. Over 880 substances were reviewed during this time, and about 168 were definite carcinogens, probable or possible human carcinogens. This was updated by Loomis, as I mentioned before, and they determined that 47, so the number increased from 28 to 47 listed as occupational carcinogens. And among the cancer sites where occupational carcinogens are most important include lung cancer and bladder cancer, cancer sites that were mentioned earlier this morning. Now, for lung cancer, there are several classes of chemicals, many chemicals that are listed as group 1 carcinogens for lung cancer. These include metals and metal compounds, airborne particles such as asbestos. We know about that, so that's probably the most well-characterized occupational carcinogen. Outdoor air pollution, also complex mixtures. We heard about engine exhaust, diesel exhaust earlier today, tobacco smoke, secondhand smoke, also in the occupational setting. Some chemicals and chemical mixtures, and also radiation was found to be an occupational carcinogen. And for urinary bladder, the number is fewer, but there are several more that are both probable and possible carcinogens for urinary bladder. So currently, this is where we are right now. There are a total of 120 group 1 carcinogens. This is both occupational and environmental. Almost 500 that are both carcinogenic to humans, group 2A or group 2B. So we know, as Molly stated, that much of what we know about carcinogens comes from the occupational setting. And we know that folks in the occupational setting are exposed to chemicals and other substances at a higher dose, and they may represent a smaller population. But we also know that some of those same chemicals that individuals are exposed to in the occupational setting, they're exposed to in the environmental context. So sometimes, most of the time at lower doses, but not always. And then in the larger population, as in some of the communities that you heard about earlier. So one of those in which individuals are exposed to in an occupational setting, and also in the environmental context, is organophosphate pesticides. These are probably the most commonly sold pesticides, and the general population can be exposed from drift. So if individuals are working and they're spraying pesticides, those pesticides can drift, and individuals in the population can be exposed. They get into our water and food supplies, and then they can concentrate up through the food chain. IARC has listed some of these types of pesticides as probable or possible carcinogens. Some of the work that has been done, for example, in our division of epidemiology and genetics, our intramural division, using the agricultural health study, looked at pesticide exposure among spouses of pesticide applicators. And they found that overall, any organophosphate pesticide use was associated with breast cancer. So 1.2 times more likely if you used any organic pesticide to develop breast cancer than if you didn't. We also saw a strong risk for thyroid cancer, for malathion, and also a decreased risk for non-Hodgkin's lymphoma, which it's hard to explain that, but given the lack of biological plausibility there, the result is probably by chance. And a strong risk for ovarian cancer. Now, organophosphate pesticides are thought to be endocrine disruptors, meaning that they disrupt hormones. And as you can see, that the risk of developing cancer, all these cancers are hormonally based cancers in women. The general population can also be exposed to arsenic. There are some areas in the United States where the arsenic concentration is really high, some places in the Northeast and also in the Midwest. Arsenic is a group 1 carcinogen. It is carcinogenic to humans. We can primarily be exposed through water ingestions, but also through the air that we breathe, food, and also through tobacco smoking. Industrial exposure occurs through inhalation, and the individuals can be exposed in a population to drinking water in unregulated private wells. Now, the amount of arsenic in public water sources is low, but we don't know the impact that low levels of arsenic have on the risk of developing cancer. That's an unanswered question. The population exposure to arsenic has been associated with bladder cancer, skin, lung, prostate, pancreas, and other cancer sites. We heard some, and I believe Ted's talk this morning, that we are also exposed to chemicals in personal care products and also other consumer products that we use. What I have listed here is a number of common personal care products and the types of chemicals that are in these products. And these chemicals listed here, the parabens, the phthalates, and perfluorinated chemicals like perfluorinated oxynucleic acid. These are thought to be endocrine disruptors and have been associated with the risk of developing breast cancer, testicular cancer, bladder and prostate cancer. And so exposure to these products may put an individual at risk. Often what we do is we are measuring these chemicals in the general population. So we do have a baseline for this, some baseline measurements of these chemicals measured by the National Center for Environmental Health at CDC's biomonitoring program. So if you're interested in that, you can take a look at that website and you can see a listing of all the chemicals and the levels that individuals are exposed to in the population. And these phthalates and other endocrine disruptors are among those chemicals. I won't get into hydraulic fracturing only because this is going to be a topic later this afternoon, only to say that this new way of getting oil and gas is pretty widespread across the United States right now. And a lot of chemicals used in the process have been classified by our IARC as Group 1, Group 2A, or Group 2B carcinogens. That means that, that these are carcinogenic to humans, and we are exposed to these through this process. So I've just been given a 3-minute warning. Time flies, I'll tell you. But I just want to highlight here, I'm part of the epidemiology and genomics research program. And if you can take a look here at the top, the environmental epi, you see that about 8% of our $150 million awarded budget goes to supporting environmental epidemiology grants. We want to grow that number. You can see a lot is on the more sexy genetic and epigenetic factors, which are important, but I think that more attention needs to be given to understanding the environmental causes of cancer. And what we support in this program includes work in low and middle income countries and understanding that. One of the projects is the Breast Cancer and Environment Research Program. This is a wonderful program, transdisciplinary approach, meaning that individuals from multiple disciplines come together and try to solve a common problem using a common conceptual model. It includes basic scientists, epidemiologists, and it also engages the community in the research. So the community has a strong input in framing the type of questions that are asked in this project. It looks at a number of diverse environmental exposures. Primary among them are the endocrine disruptors that I spoke about earlier. We use a windows of susceptibility approach, understanding that there are particular periods in a life where an individual may be more susceptible to the effects of an environmental carcinogen or environmental agent that could last a lifetime and increase their risk of developing cancer decades later, as Ted mentioned earlier. One project has been done by Barbara Cohn in the Child Health and Development Studies Pregnancy Cohort. This is a study that looks at the prenatal period, and it's a 54-year follow-up of 9,300 daughters of women who were in that pregnancy cohort. It's a nested case control study matched on birth year. They measured DDT, which is an organochlorine pesticide, in mother serum. They found a very strong risk of developing breast cancer in the daughters. The odds of developing breast cancer among those who had high levels of DDT in the mother's serum is almost fourfold than those who had lower levels. And then I'll wrap up right now. Proximity to a major road was shown to be associated with earlier puberty development in young girls. And the proximity to a major road was used as a proxy for traffic-related air pollution, which we know has a number of chemicals such as polycyclic aromatic hydrocarbons that can increase the risk of developing cancer. So some of the things that we're supporting to extend this work is we have a program announcement on early life factors in cancer development later in life. We want to stimulate research in this area to understand what factors early in life increase the risk of developing cancer later on. We are particularly interested in environmental factors. Samdat Mahabir is the contact for that. We're also interested in liver cancer. Liver cancer is increasing, the incidence is increasing in the United States. But you can see that it's also increasing at a faster rate in Pennsylvania. And there's an unequal increase in risk, and these are mortality rates. The mortality is rising, but we see that it's rising faster among African Americans and Latinos. So we know some of the risk factors is largely driven by hepatitis B and hepatitis C virus, but we're also interested in understanding some of the novel risk factors for liver cancer, including environmental contaminants. And then, so Tram-Lam is leading this effort, and we hope to get applications in to help us understand why this cancer is increasing in the population outside of what we know regarding hepatitis B and hepatitis C. These are a number of resources that we have available to do this work. The Cohort Consortium is a major consortium of about 59 epidemiology cohorts. There are more than 7 million individuals with high quality data. About 2 million of those have biospecimens, some collected at multiple periods of time. This is a resource that investigators can use to look at environmental factors in cancer. And we also signed on to the HERE initiative with NIEHS. This is designed to have NCI investigators who have biospecimens and they want them assayed, to have them assayed for environmental exposure so that they could extend the work in understanding the environment and cancer. So these are some of the things that we're doing to move the science forward in the environment and cancer. And finally, I was asked to give recommendations. I'm from a research organization, so most of my recommendations are around research. I do want to mention that we do know a lot about what causes cancer. We do know, I've highlighted some of the environmental carcinogens that we know about, so we can do something by avoiding or organizing so that we can avoid exposure to these environmental carcinogens. So acting on what we know, taking precautions. Looking ahead, there are a number of carcinogens where there's limited epidemiologic data in humans, so we need to further evaluate those agents that may be linked to cancer in animals, but we don't know a lot about what happens in humans. We should look at that as well. Prospective studies would be good to incorporate biologic and mechanistic components. We don't need to wait until the development of cancer. We know that there are certain biological pathways that are important in cancer development. So looking at that before the development of cancer would expand our knowledge. Also, the evaluation of cancer risk associated with low levels of environmental contaminants and complex mixtures, I think is really important, and I think our next speaker will speak more broadly on that. And then investigations of environmental exposures in different populations. Jamil gave a wonderful presentation earlier this morning, and I think that we need to focus on our health disparate populations who are more likely to be exposed to environmental toxicants. So stay in touch, and I'd like to acknowledge some of my colleagues who helped, and please reach out to me. I'm happy to talk to you about your ideas. Thank you.